Aging is an inevitable process, and one of the most commonly asked questions I get as a board-certified dermatologist is, how can I look younger? And this is a concern that bothers women and men alike. So today I thought it would be helpful to do a video on aging and what are the common procedures that can help you look a little bit younger and more refreshed. Now, when we're talking about aging, I'm mostly speaking to our facial appearance, not only to our skin, but also to what's underneath the skin, deeper fat components, as well as the bone on our face. All of that cumulatively, those changes will give us some of the undesired appearances such as dull texture, fine lines, wrinkles, uneven skin tone, deeper wrinkles, loosening of the skin, even say like jowl, the double chin. So there are a couple of things you want to think about in this kind of the superficial part, which is really the skin and what's happening at the surface level, but then deeper that we don't see as readily. And both of these play a role in the way we age. Well, when it comes to the skin, over 80% of the aging of the skin is induced by ultraviolet radiation. Fine lines and wrinkling, dullness, the discoloration, all of that is really just accelerated by ultraviolet radiation. Genetics do play a role. Other lifestyle habits like smoking, stress, chronic sleep deprivation, poor diet, all of that can also accelerate the appearance of aging. As we get older, just naturally, certain things are happening to our skin at a more microscopic level. Starting in our 20s, we start to lose collagen and make less of hyaluronic acid. And both of these things is what gives our skin structure, plumpness, that elasticity, and that hydration, which is why more mature and older skin looks dull, because your skin turnover is also slowed down, so there's more retention of that skin. You have fine lines and wrinkles building up, you have uneven texture, uneven skin tone, and also older skin tends to be drier. Now, what is happening underneath the surface of our skin are a couple of things. So we also have fat in our skin, and we will lose some of that fat. We call that fat loss on their skin that, you can think of as babies and young kids that have that chubby cheek. And to a degree, people that have a little bit more fat in their face will look a little bit younger as they get older, or tend to age a little bit more gracefully than those who don't have as much fat. And that is because that fat does portend more youthful appearance overall. So we lose that fat volume, but also we have ligaments as well as deeper fat that will change position with time, that kind of descend. And also, believe it or not, the skull, the bone on our face will also resorb and change a little bit with time. So all of that will lead to basically what we call hollowing of your temple, hollowing of your cheeks. And because all of that hollowing and shifting of the ligaments and deeper fat components, you get descent of tissue. So this is where you may get deeper nasolabial folds, marionette lines, and a little bit looser skin, even maybe some of that jowl or double chin along the jawline. Furthermore, with repetitive motion over time, muscle movements that we create either with frowning, smiling, laughing, all of that will start to kind of etch into the surface of our skin. And this is where you get more what we call dynamic wrinkles that are present regardless of whether you are making those facial expressions or not. Now, one of the most common questions I get is, can I prevent aging in some ways? And when it comes to skin aging, prevention is really where the money's at. Because so much of it is UV induced, you can definitely delay the appearance of a lot of the signs of skin aging with good protection. What I mean by that is sunscreen, which is why as dermatologists, you hear us hampering on sunscreen all the time, not just for the skin cancer prevention, but also to delay the onset and the appearance of skin aging. So what are some of the common cosmetic procedures that are available that are performed, and what should you do? We can never, nor do we want to make you look 20 years younger. The goal with cosmetic rejuvenation procedures, especially the ones that I'm going to be talking about, the ones that are minimally invasive, even the surgical ones, the goal is not to make you look like you are 20 when you are 60, right? But it's just to make you look more refreshed, but in a really good way. But yet people can't quite point to exactly what you had done. And a good cosmetic procedure is really that, right? Now, the other question I get a lot is, when when should I start thinking about cosmetic procedures? And again, this is such a personal question. There are people that will get preventative Botox in their 20s, early 30s, especially if you are fairly expressive. I think that is definitely something that you just determine for yourself what makes sense for you. Okay, so let's talk about the most commonly performed procedures by a dermatologist. Number one is probably going to be Botox. Botox is just like a term you throw around, but it's really used to describe botulinum toxin. And it's a toxin produced by a bacteria that we know have neuromodulating or basically paralysis effects of your muscle. Now, there are various different types of botulinum toxin that exist on the market that are FDA approved, used for medical as well as cosmetic reasons. I'm not going to dive into all of them, but just understand that there are various types that exist. They all work similarly in helping to treat the dynamic lines. So the lines that deepen with movement, that come with muscle movement. So for example, like the 11s, the forehead lines, the crow's feet, all the toxins are similar. They usually last about, 3 to 6 months, and they can vary a little bit in price point, but the way they're injected are fairly similar as well. Now, Botox is FDA approved to treat what we call the 11s, and I have Botox in right now, so I can't frown, nor can I look up very well. It works really well, right? Now, obviously, I chose to not be very expressive, but the beauty of Botox is number one, you can choose to have the volume and concentration injected where you can still preserve some more natural appearing look and movement all the way to completely frozen face. And the other beautiful part of Botox is because it's only temporary, if you didn't like it, once it wears off, you don't have to get it again. But the downside is that because it is temporary, if you do like it, you do have to keep getting it. And so that can be something you have to consider for your budget as well. Now, off-label, it's used to treat a lot of different areas, and it can even help to, in some ways, reshape certain features that you have. For example, some people that have like a gummy smile, like their gums would show, you can inject a little Botox into some areas of your mouth that will decrease the amount of gummy smile, the gummy show. Some people that have like bunny lines, they have these wrinkles in their nose or even their chin, you can inject Botox into these areas to minimize the lines of that. Also, people that have a very strong masseter muscles, that have a square jawline, you can inject Botox into masseter muscles to really soften your jawline and to create a more feminine look. And so there's a lot of different uses of Botox, including one last thing that I can think of is using Botox to do a little lip flip. So injecting Botox into a few parts of your lip to relax the muscle of your mouth to create a more fullness to your lip without having to have fillers done. Now, when it comes to Botox, a lot of reasons why people choose to get it done is number one, it's very easy and it's very quick, and the results are not permanent. And there's relatively less downtime and risk to it. For the most part, the risks of Botox are just a little bit of pain with injection, maybe bleeding and bruising, and that's pretty much it. And this is where going with an experienced injector is really key. There are certainly areas that can be a little tricky where if it gets into the wrong plane, may have a less desirable look, but otherwise there isn't really a lot of serious side effects to getting botulinum toxin done. Next, let's talk about fillers. Fillers is one of those treatments that can really make a significant impact on one's appearance. I'm mostly going to just talk about hyaluronic acid-based fillers. There are lots of different types of fillers that exist on the market. Hyaluronic acid-based fillers are probably going to be the most common, and they work mostly by filling in that empty space or adding volume back to your face that has been lost with the aging process. Now, there are lots of different types of hyaluronic acid fillers that exist on the market. They differ in the viscosity and stiffness, which is nice because, as you can imagine, the way you want your lip to feel would be very different than what you want your cheeks to feel. And so those different types of fillers can be used to tailor and use on different areas to give the aesthetic outcome that is desired, but also doesn't feel unnatural. The more viscous ones are often maybe injected on bone or deeper, and that is more to help with replenishing volume loss. So that is more often done like around the temple or around the cheeks. And then more softer fillers are then done around the folds on your lips. So that way it feels more natural and looks more natural when you are smiling and talking. Most of these fillers will last between 6 months up to a year or a little longer, and they will have a range of different price points depending on the type that is used. Now, when it comes to fillers, this is where I cannot stress enough. You absolutely need to see an expert, as you should with all cosmetic procedures, right? But fillers can have more serious potential side effects if it's not done correctly. So the common ones, again, would be just bleeding, bruising, and swelling. But fillers, because they're more viscous, they have a potential, if done incorrectly, in occluding the blood vessels, which we have a lot of on our face. And in certain areas where blood vessels may be more superficial, or if you have someone who is not well versed with the facial anatomy, you can potentially occlude a blood vessel, which means you can get breakdown of your skin, leading to skin ulceration. And the scariest would be even potentially going blind. And there have been few case reports of that, and luckily just a few, but this is where you need to see an expert. But overall, common ways of using fillers, as I mentioned earlier, are to help with replenishing volume loss, so helping to add some fullness and volume back to the cheeks that we lose over time as we age. And that indirectly will help soften some of the deeper folds on the lower face. It can be used very commonly to fill in the lips, because that's another area that we lose volume and gets wrinkly and becomes flat over time. Commonly used to treat the nasolabial folds and the marionette lines, and then also have been used off-label to augment the chin, the nose, as well as add more definition to the jawline. So there's a lot of things that you can do with fillers. Again, how it should be used, what should be used, should be very individualized, and that recommendation should be very personal. Now, lasers and light treatment can also be very helpful, and I find them to be the most helpful in really making a difference for the superficial changes of the skin, and so uneven texture and skin tone and fine lines. So lasers are essentially using light as a source energy in a term that's called selective photothermolysis. Basically, there is a target within your skin that laser focuses on and is able to generate energy and therefore the desired outcome. So for example, if you have a particular laser that the target is hemoglobin, it helps to treat blood vessels or redness in the skin. Similarly, if you have a laser that targets pigments like melanocytes, you can get rid of hair. That's how hair laser removal works. Now, when it comes to addressing concerns of aging, the most common ones used are probably going to be your resurfacing type of laser. So your ablative or non-ablative fractionated laser. So a lot of people will call them Fraxels. And how they work is that the target is water, which exists on top layer of the skin. It's fractionated because the energy isn't delivered throughout the skin, but in little tiny thermal energy zones. And what's happening is with that, it is able to penetrate into your skin, but not extensive enough where it's causing a lot of damage. But the whole idea is really kind of generating a series of wound healing that then allows your body over time to create more collagen and therefore softening the top layer of the skin, but also in some ways resurfacing some of that superficial texture change at the same time. And this is in some ways how microneedling works as well. A similar concept, but it's just that microneedling, you're not using heat, you're literally using tiny needles poking holes in your skin, but not big enough to cause scarring, but enough to cause wound healing and therefore collagen production. Now, a lot of these times, these resurfacing lasers, it's more of a delayed gratification. The results really are seen 3 months, 6 months after the treatments are performed. And usually it requires a series of monthly treatments, maybe 3 to 5. And then after a while, you will notice the results. But this can be helpful for people that are noticing really diffuse fine lines, just overall even skin texture and skin tone. Now, you can kind of achieve that with chemical peels, although you would need to use a much deeper type of peel to get the same outcome. And a lot of times, because we have so many other tools readily available, that the deeper chemical peels have fallen out of fashion. But I'm not going to dive too much into chemical peels, but that is another procedure that is very common that can be done for all sorts of things, from just exfoliating, right, the superficial peels, to helping with maybe improving some of your acne scars, like TCA peels that are commonly done for ice pick scars, to some of the deeper peels that will over time help with skin rejuvenation as well. Now, last thing I want to talk about is radiofrequency. And radiofrequency is not the same as laser. They actually work in a different way by heating up water and generating reaction that way. So theoretically, it is definitely safe for all skin types, most skin types, versus lasers. Depending on the type of laser, some aggressive ones may not be as ideal for darker skin tones. Radiofrequency treatments are mostly used for tissue tightening to help remove some of the adipose or fat tissue, and that is where it's most commonly done and can be used a lot of times combined with, like, say for example, radiofrequency microneedling, where it can help with improving some of the texture changes, uneven skin tone, but also giving a little bit of the tightening effect. Okay guys, so that was a very quick rundown of the various different types of cosmetic procedures that are performed by dermatologists. Hopefully this will give you an idea of what is available, and the right treatment really needs to be determined by you and your provider. Comment below with any questions that you may have about any of these particular procedures. I know that was a very brief overview, and if you like this video, please give it a thumbs up, and I will see you guys next time. Bye!